Thank you very much, and thanks a lot for coming, and to the organizing committee for organizing a fantastic UN conference. So today I'm going to talk about the changing landscape of pregnancy diabetes and integration of artificial intelligence. It's the new thing that everyone wants to be involved in, so I'll try and summarize it briefly for you today. A little bit about me, as we've mentioned, I do a whole bunch of different endocrine stuff, but I don't think that gives a true picture of who I am. I'm going to scratch that and say I'm a lifelong Australian. I was born in Ahmedabad, but I moved to Australia when I was 1 month old. I can speak Gujarati fluently. I'm a Chelsea fan, love Indian cricket team, anyone but Australia. Growing up, hated watching them win against everyone. Been to over 50 countries, speak 5 languages, only have 4 brain cells, so if I get difficult questions and I can't answer them, I apologize in advance. And I love technology. So I'll go right into it. In regards to pregnancy diabetes across the world, gestational diabetes has a global prevalence of approximately 14%, and in India it's over 20%, and that number is also likely underrepresented in the context of many patients not having tests done to begin with. It has significant impact on maternal and fetal health, including macrosomia, preeclampsia, stillbirth, as well as type 2 diabetes postpartum. Timely diagnosis and management are key factors in improving outcomes. So what are the challenges that we have in managing GM? First and foremost, there's variability in healthcare infrastructure and access to diagnostic tools. Secondly, there's high rates of undiagnosed GDM due to limited screening or awareness. There's inconsistent healthcare delivery, leading to suboptimal management, and there are impacts of social determinants of health as well, including their socioeconomic status or their education. So, in regards to limited early detection, if we can't identify which patients are being diagnosed with GDM, it's hard to try and treat and prevent complications, and this is where AI can be very useful. The second arm where it can be useful is in healthcare disparities. For example, if someone lives hundreds of kilometers away from the nearest hospital and we want to try and treat their GDM, at this point in time it's extremely difficult. So we can utilize artificial intelligence to try and bridge that gap and enable adequate and consistent care across the globe. Finally, in regards to complex management, often there are patients who are requiring treatment, there are patients who are in resource-rich settings, resource-poor settings, and as we mentioned, some hospitals may only use insulin, others may consider metformin, trying to find artificial intelligence as an avenue to summarize all of the different treatment options and guide us, even if there are not doctors around, on what to do next for patients depending on how well controlled their glycemic readings are. So, the role of AI in transforming healthcare. First and foremost, we need to understand what is AI, and I'm sure you're all very familiar with the basics, so I'll rush through this part, but it refers to the simulation of human intelligence processes by machines, and it includes data processing as well as decision making. There's many different types of AI, and I don't have enough time to go into it, but there's exciting things coming up in the next 12 to 24 months that I can allude to at the end. Machine learning, deep learning, and natural language processing are the key techniques used to build AI models, and this is something that any one of us could do for our hospitals or for our clinics, as long as we have a brief understanding of how to integrate it in the appropriate ways. AI is transforming healthcare by improving diagnostic accuracy. For example, as we see with diabetic retinopathy screening, AI datasets are now proving to be as good as, if not even better, than clinicians in diagnosing diabetic retinopathy. There's automating routine tasks which can allow us to give more time to our patients. There's precision medicine that we can incorporate based on patient histories, and also personalized patient care as a result. AI models are used to analyze vast data sets of information from EMRs, CGM, as well as lab results for us to be able to predict and diagnose as well as manage diseases like diabetes. Now, as an example, as Paulina mentioned, there's a dilemma where GDM screening recommendations vary internationally, and there are controversies around the 4 points that I've listed there. So first and foremost, Do we do universal screening for patients with GDM or more selective screening? Secondly, do we consider early pregnancy screening or not? And in Australia, in addition to the studies Paulina mentioned, there was also the toboggan study that happened with Professor David Simmons that I was a part of, and there are possibly changes to guidelines in regards to early gestational diabetes treatment or diagnosis as well. Third is a one-step or two-step approach in the context of early diagnosis, and fourth is what the actual diagnostic criteria should be. Now, how can we develop a unified approach that can be globally applicable so that we don't have all this confusion between countries, between hospitals? And AI is where we can use that. Now, it's being used to predict diabetes management, diabetes risk in populations by analyzing a combination of medical data, including a patient's BMI, the HbA1c trends, their age, their ethnicity, family history, as well as lifestyle factors. So why can't we do this for GDM as well specifically? We absolutely can. An example of a study that has looked into this is a meta-analysis conducted by Tu et al. In 2023. This evaluated the effectiveness of different types of machine learning models in predicting the risk of GDM. There were 25 studies that were included, and 9 of these included women with previous GDM. Linear regression models were used in 17 out of 25 of these models, with the 8 remaining models being more variable types of models. If we look into the details of what these models included, the key parameters that were consistent across the board were the maternal age, the family history of diabetes, their BMI, and their fasting glucose levels. And so we've factored those in as key points to include if we were to create a model ourselves. Now, looking at the overall specificity and sensitivity of these models, regardless of whether they were linear regression or non-linear regression, sensitivity was 0.69 and specificity was 0.75. Now, if we compare this to current selective screening as opposed to general population screening, where you'd expect it to be 100, the selective screening comparator is quite equivalent in regards to machine learning models that currently exist in their early iterations versus what we do from a selective screening perspective. So extremely promising, extremely time efficient, and also fantastic for patient care. The advantage in AI models compared to what we would traditionally do is that there can be earlier detection. And this is because machine learning is able to forecast based on data from as early as 8 weeks gestation up to 24 weeks gestation. And there was one model included in that meta-analysis that could detect possibility of GDM in patients' future pregnancies from pre-pregnancy data. Now, we look at the area under the receiver operating characteristic curve, and we found that if we compare linear regression to non-linear regression, in actual fact, the non-linear regression was a little bit more accurate. And so maybe in future, that is the way forward. Now, in the context of time, I'll skip through some of these things, but I'll briefly mention that in our district in Sydney, we have incorporated AI algorithms for detection and diagnosis of GDM. So instead of having a clinician look at a blood test result and then contact a patient or liaise with midwives or nursing staff, we can automate this whole process, and it saves a lot of time, a lot of admin effort, and it has been extremely beneficial. And we need unified systems for this to happen. I'll go through briefly the ethical and regulatory considerations. Now, first and foremost, data security concerns in AI and healthcare are a big talking point. The need for standardized, transparent AI models and validation before clinical use, as well as regulatory frameworks, for example, with the FDA, CE marking in Europe and other global standards is important. The other key thing is scalability and adaptability, because there's no point having a model if we can't utilize it globally or at least in a larger scale. Now, future directions. So we've talked about diagnosing GDM. How about using it for patients' personalized insulin regimes, using diet applications, for example, take a photo of your food, tells you how many carbohydrates there are, guides you on insulin dosing, as well as messaging and interactions for patients that may have questions. Ongoing research is imperative. Future technology might include wearables, and agentic AI is a very big factor coming up in future as well. If you have any ideas but you're not sure how to execute, come and find me. Thank you very much.